So our focus is blood cancer. So we got new insights into the development on blood cancer. So what drives a normal cell mad to become malignant, to become leukemic, and which are the genetic and epigenetic factors which drive these cancers.
So what we do is to try and understand what happens between the DNA variation and the change in protein. What are the steps in between, which will lead us to in-depth understanding about this chain of events.
We thought when we started cancer is essentially a genetic disease. What we learned during the process of a project was that single or few genetic hits can have a kind of avalanche effect. So they can reprogram the whole cell.
What we have found during in our studies in Blueprint is perhaps a new concept which is called epigenetic memory. We have studied this B lymphocyte, not only the memory B cell, but all the maturation stages of the B lymphocyte. And we have seen that each particular maturation stage maintains an epigenetic memory of all the past activity states, so that the final destiny of the B cell, which is a plasma cell or a memory cell, contains in its epigenome all the history. It's a kind of, the epigenome is like a kind of storyteller. It's telling us, what has happened during the entire process. And the final cell contains the whole book, the whole history,
What this research is giving us is really an insight of what happens at the molecular level where you carry a faulty gene. So when a gene that predisposes you to disease, what it does at molecular level.
The results that we have generated up to this point, so we're end of year 4, are far beyond what we had planned 4 years ago. We probably have doubled from what we thought we would be able to achieve. We have now a very deep understanding, more than we had hoped for.
Our goal is first of all to bring our research into a patient. So what we first wanted to have is new diagnostic tools to understand which subsets of cancer we had, which might need certain or different treatment. And finally, obviously, the ultimate goal is a kind of targeted therapy which might reprogram the cells. At the moment, we have only some like reset buttons in which we can reprogram everything, which might have side effects. But it will be the ultimate goal to have dedicated drugs which allow to reprogram certain bits and pieces of a program.
The last year that we now have will be finishing up some of the stories, some of the work that we're doing, which still need to be finished up. And then I think what will be the goal is to translate this into the wider community, to bring it to the attention of clinicians and other people, to really start making use of the data. That will be our last year, and then beyond there's an horizon and there is a lot of money needed. Bring this to the EU.